Dr. A. We often see patients with facial paralysis, and while clinical exams are crucial, electrophysiologic tests help us assess prognosis. Let's go over the key tests. Dr. B. Absolutely. These tests measure nerve and muscle response to electrical stimulation, helping us predict recovery outcomes. Dr. A. First up, the nerve excitability test. This determines the lowest electrical stimulus needed to elicit a facial twitch. Dr. B. Right. A threshold difference of 3.5 milliamperes or greater between the affected and healthy side suggests a high chance of incomplete recovery, about 80% accuracy. Dr. A. Next, we have the maximal stimulation test. Here, we apply a supramaximal stimulus and observe facial muscle contraction. Dr. B. If contraction is markedly reduced, less than 25% of the healthy side, within the first 2 weeks, there's a 75% chance of incomplete recovery. That makes this test useful for early prognosis. Dr. A. Now let's talk about electroneuronography, ENOG. This measures the compound muscle action potential, CMAP, with a supramaximal stimulus. Dr. B. If the CMAP is reduced to 10% or less of the healthy side within 2 to 3 weeks of paralysis, poor recovery is likely. That's when surgical decompression might be considered. Dr. A. Lastly, we use electromyography, EMG, to detect spontaneous and voluntary muscle action potentials. Dr. B. Yes. If fibrillation potentials appear within the first 2 weeks of paralysis, it predicts incomplete recovery in 81% of cases. This helps us counsel patients on expected outcomes. Dr. A. So, to summarize, nerve excitability and maximal stimulation predict early recovery. ENOG helps assess nerve degeneration, and EMG detects muscle viability. Dr. B. Exactly. Using these tests in combination improves our ability to predict and manage facial nerve injuries effectively.